Hello, I'm Michelle Marshall, the Assistant Vice President for Oncology Services at Inspira Health Network. On behalf of Inspira, I'd like to welcome you to our panel discussion, Life After Smoking, for you and your family. Lung cancer is the second most common type of cancer, according to the American Cancer Society, accounting for nearly 14% of all annual cases diagnosed. In the U.S., there are about 230,000 new cases diagnosed each year, and in New Jersey, we see about 7,000 of those. The number of cases diagnosed in South Jersey per capita is nearly 30% greater than that of the state. Lung cancer is a very real problem in our community, and Inspira is committed to our community, to not only treating patients who have the disease, but to empowering patients to prevent the disease and to detecting early when lung cancer is most treatable. We're committed to providing tools for prevention, such as smoking cessation, and enhancing our multidisciplinary lung cancer program with staff and technology to help to enable early detection. We're in the process of launching a comprehensive quit center with funding provided through the state of New Jersey that will enable us to offer smoking cessation services at no cost to people in our community. We've opened a state-of-the-art radiation center at our Woodbury campus to complement the one that already exists in Vineland, where we can offer stereotactic body therapy for patients with lung cancer. We've also expanded our lung cancer screening centers of excellence, offering low-dose CT screening to eligible patients at 4 locations and more to come. Our state-of-the-art diagnostic technology enables us to detect nodules early when they're still treatable. And our new cancer center is coming to Mullica Hill, slated to open in the spring of 2020, that will bring together all of the components of our multidisciplinary lung cancer team. The goal of our discussion today is to encourage high-risk adults to get screened for lung cancer and to quit tobacco if they're still using. We're also looking to support families with valuable information and to make sure that you're aware of the services that are available to you right here in your community. So what to expect from our panel? Our panel consists of a primary care physician, a pulmonologist, and a certified tobacco treatment specialist who was recently instrumental in writing a grant for 3 years worth over $500,000 that's enabling us to open our quit center. With that, I'd like to turn it over to Dr. Bullock to introduce herself.
Hi, I'm Dr. Tara Bullock. I'm a family physician at Inspira Primary Care in Williamstown. I've been in practice for over 15 years. I see patients of all ages, children as well as adults. I have a special interest in adolescent medicine as well as preventative care.
Dr. Bullock, can you tell us, what do you tell your patients about smoking and lung cancer?
A major part of my practice is preventative medicine. So when I talk to my patients about smoking, I let them know that it is the leading preventable cause for death and illness. And when it comes to cancer, early treatment is the key, and that involves early diagnosis. 80% of cancers are curable if caught early. So I see patients of all ages. So for my adolescent patients who are most likely to start smoking, I try to talk to them about not smoking and the risks of smoking. For my patients who are smokers, I try to come up with a treatment plan to help them quit smoking. For my patients who are high risk for lung cancer, I usually screen them with low-dose CT scans of the chest annually. I'll refer to a pulmonologist if there's an abnormal CAT scan of the chest or if the patient is developing illness because of smoking, like COPD or emphysema.
Thank you, Dr. Bullock. I'd now like to ask Dr. Plush to introduce himself to the audience.
Hi, I'm Dr. Ted Plush, pulmonologist with Inspira Medical Group. I specialize in diseases of the lungs and help care for patients with lung cancer. I have advanced training with bronchoscopic, diagnostic, and therapeutic techniques which can help patients with lung cancer. I have authored many articles in the field of pulmonary research, including pulmonary embolism articles, as well as articles about lung cancer.
Dr. Plush, what are the most important things you tell your patients about lung cancer prevention and smoking cessation?
Lung cancer prevention is based on 2 important concepts: smoking cessation and lung cancer screening. Smoking is the #1 cause of lung cancer. Some people who have been smoking for many years think it might be too late for them to quit. However, quitting smoking at any time can help prevent lung cancers and diseases with smoking. Now, quitting smoking has great effects on the body. Within 20 minutes, you could see your heart rate and blood pressure decrease. After 1 year of smoking cessation, your risk of cardiovascular disease is cut in half, and that continues to decline over time. Much of the diseases that happen in the lungs from smoking are irreversible, but quitting smoking can help prevent further decline. You'll be able to breathe easier with less wheezing, coughing, and mucus production. Smoking also affects the body's immune system, which is how the body fights against diseases. Quitting smoking can help your immune system fight against these diseases and help your body heal. Screening is what we do when we look for diseases in high-risk people that have no signs or symptoms of the disease. The only proven screening for lung cancer is called a low-dose computed tomography scan, or called a low-dose CT scan. Screening is important because finding cancers early is important in curing them. Now, the United States Preventative Disease Task Force recommends screening be done in patients who are aged 55 to 80 with a 30-pack year smoking history and are current smokers or have quit within the last 15 years. 30-pack years of smoking means they've basically smoked 1 pack a day for 30 years. Now, there are many risks to screening as well, and this is where shared decision-making with the pulmonologist or the primary care physician comes in. Many times, nodules are found on a CT scan, which is a small area of abnormality. 95% of the time, these are not cancerous, and this can lead to overdiagnosis, alternate testing, surgeries, and other issues like anxiety when patients have to think about this. So, shared decision-making with the pulmonologist or the primary care physician is an important aspect in lung cancer screening. You shouldn't be afraid of screening though, because studies have shown that lung cancer screening can reduce your risk of death from lung cancer by 20% and the risk of overall death by 7%. So it's important to discuss with your physician regarding screening.
Thank you, Dr. Plush. I'd now like to ask Brittany Raup to introduce herself to our audience.
Hi everyone, my name is Brittany Raup. I am a certified tobacco treatment specialist. I am the oncology grants manager at Inspira Health Network. I've been with Inspira for 11 years and my background is in health and exercise science. I'm currently pursuing my master's in health promotion and wellness management.
Brittany, can you tell us about your work in preventing lung cancer and also the new Quit Center that will be opening in January?
So as a certified tobacco treatment specialist, my job is to help people quit smoking at any stage of their care, whether that's before any disease has happened or they're already diagnosed with lung cancer. In particular, I work with patients who have had a low-dose CT screening, as was mentioned before, because these patients are very high risk for developing lung cancer. It's very important for them to quit smoking. Inspira is a lung cancer screening center of excellence, and we are committed to detecting lung cancer early by following up on incidental findings that are discovered through CT scans. So our Quit Center is very exciting. It's going to be launched in January of 2019. We recently received funding to be 1 out of 10 Quit Centers in the state of New Jersey to offer smoking cessation out in the community. This is a collaborative effort between our population health and our cancer services team. So we'll be working together to bring smoking cessation services into the community. It will include one-on-one as well as group sessions and free nicotine replacement therapy, which is really important for quitting smoking. So we're very excited to present this to the community because smoking is the leading cause of preventable death and disease.
Thanks, Brittany. Just one follow-up question. Can you tell us what's the best way for someone to quit smoking?
Sure. So there are many ways to quit smoking, and for the average person, it can actually take 8 to 10 quit attempts to be successful. But research has shown that combining meeting with a tobacco treatment specialist and using nicotine replacement therapy has been more effective than going cold turkey.
Thank you, Brittany. Before we go into Q&A, if you're enjoying this, I invite you to sign up for our email listing. Through our listing, you'll be able to get invitations to our Facebook events as well as our live community events. There's information on your screen with the website where you can sign up for more. We'd now like to transition to some pre-submitted questions for our panel. Can you guys tell me, is lung cancer the only cancer risk that's associated with smoking?
No, unfortunately not. Lung cancer is the most common cancer associated with tobacco use. However, there are other types of cancers such as oral cancer, throat cancer, kidney cancer, liver cancer.
As well as bladder cancer, pancreatic cancer. So it's really important to quit smoking and to talk to your primary care doctor about different screenings for these cancers if possible.
Vaping has become very popular nowadays. Is that a safer alternative to smoking, and does it also increase risk for lung cancer, or is it safe?
So vaping is becoming very popular, especially among youth. Vaping may be less harmful than traditional cigarette smoking, but it's not harm-free. And because of the attractive flavors and the packaging, it is just very attractive for youth to participate in. And what we're finding is that more middle schoolers and high schoolers are vaping when they would not have picked up a cigarette to smoke. It still does contain nicotine, which is addictive, so we find that younger kids are getting addicted to nicotine, and then often they're dual using both the vaping products and the cigarettes. Electronic cigarettes also contain many chemicals that have been linked to cancer risk and other diseases, so it's really important to avoid these products.
In addition, I'd like to add, Brittany, is that the World Health Organization study group concluded that e-cigarettes don't have enough nicotine to really be used as a smoking cessation aid and are ineffective as one. Also, people trying to use e-cigarettes might deter them from using actual proven methods for smoking cessation.
And the long-term effects are not known yet for these.
Right.
Brittany, can you tell us, why is it so hard to quit smoking?
So nicotine is a highly addictive chemical, which is part of what makes it just so hard to quit. So there's a lot of brain chemistry going on, and then there's also the behavioral aspect of smoking, where several, 100 times a day, you're doing a hand-to-mouth motion. So it's not only replacing that physiological craving for nicotine, but also the behaviors that are associated with smoking.
And I've heard talk about nicotine replacement, which I think addresses that first physiological need. Can you tell us a little bit more about what exactly that is?
Sure. So nicotine replacement is something that you can get over the counter or through a prescription from your doctor that replaces the nicotine that you're getting in the cigarettes with a patch, a gum, a lozenge, an inhaler. And what it allows you to do is slowly reduce your nicotine intake without getting the 7,000 plus chemicals that are in each cigarette, so that you can wean yourself off over time.
Is lung cancer just a disease for smokers, or can non-smokers get it as well?
Unfortunately, non-smokers can get lung cancer as well. Worldwide, non-smoker lung cancer actually comprises about 15 to 20% of lung cancers in men and almost 50% in women. Now, the major risk factors for lung cancer in non-smokers would be secondhand smoke, which comprises about a third of the cases, radon and other environmental exposures. Now, screening for lung cancer in non-smokers is not recommended because there's risk associated with screening, as we talked about before, and this is not a high-risk group.
And secondhand smoke can have other effects on the family as well. It can increase their risk of respiratory illnesses like bronchitis, pneumonia. It can increase children's risk of ear infections. If you have an asthmatic in the household, it can increase their flare-ups, or it may actually bring on asthma. So it's important to quit, not just for yourself, but also for your family.
One reason we often hear people cite that they don't stop smoking is because they're afraid that they'll gain weight. Brittany, can you give some tips to our audience on how to avoid weight gain while you're quitting?
Sure, that's a very common concern, and the truth is that you can gain a couple of pounds when you quit smoking, but there are some things you can do to reduce that. One thing is just to stay active, and you can use exercise as a way to stay healthy and keep your mind off of smoking cigarettes. So when you have an urge, you can take a brisk walk. Also, you can munch on healthy snacks like carrot sticks, celery sticks, instead of higher calorie foods. And most importantly to understand is that even if you do gain a couple of pounds by quitting, you are improving your health so much more by quitting smoking, and then you can work on getting that weight loss off after.
In closing, I'd like to invite each of our panelists to leave the audience with one final thought on life after smoking. Dr. Plush, do you want to start us off?
If you're thinking about getting screened for lung cancer, please talk to your doctor. And if you're right for screening, they can refer you to a high-quality screening facility like Inspira. The best way to prevent lung cancer is to avoid smoking and avoid secondhand smoke. But remember, screening for lung cancer is not a substitute for quitting smoking.
Together with your physician, you can come up with a quit plan just for you. Don't worry about it being too hard. You can quit. And you can do it for yourself, you can do it for your family and friends.
Quitting smoking is the single most important thing you can do for your health. So when you're thinking about your New Year's resolutions, even more important than losing weight, eating healthy, if you're a current smoker, quitting is the single most important thing you can do. And I will just leave you with this tip that the urge to smoke goes away after 1 to 3 minutes. So if you're quitting smoking and you have an urge, find something to do during that time and the urge will pass.
On behalf of Inspira Health Network, I'd like to thank our panelists for your time today. Thank you, audience, for watching our Facebook event. If you've enjoyed this event, I invite you to sign up for our email distribution list to receive notification of future events presented by Inspira. Thank you.